We're going to get started here. Thank you so much for being here. And I just wanted to say welcome to this year's International Women's Day event hosted by the Discourse and Cowichan International Women's Days. I'm really grateful to have been part of this and previous Women's Day events on these traditional and unceded Quw'utsun lands. We have some folks here who are attending the event in person, and then quite a few folks who have signed up to attend online, and I'm really excited that we can do this virtually so that people can access this event from everywhere. Wherever you are based, I encourage you to take some time today to learn about Indigenous women, matriarchs, leaders who have made a difference and continue to make a difference today. I can think of a lot of folks here in the Cowichan Valley who are doing great work to make our communities incredible. I also want to give thanks to Gail of Cowichan International Women's Day for helping put this together, not just this year, but in previous years too. And also thank you to Craig Street Brew Pub for hosting us. Today's event is titled Building a Circle of Care for Vancouver Island. And we have 5 really lovely panelists here today to answer the question, what supports are needed to help women make empowered and informed decisions, whatever those decisions are? So today we have Debra Toporowski, Cowichan Valley NDP MLA and Provincial Secretary for Rural Health. We have Alistair MacGregor, NDP MLA for Cowichan-Malahat-Langford. We have Dr. Emily Stewart, who works at the Vancouver Island Women's Clinic. And we have Beverly Suderman, Executive Director of the Cowichan Women's Health Collective. And then Laura Interlandi, Manager of Lelum teyt-en, House of Honourable Mothers, which is a House of Friendship program and transition home. And today is also a fundraiser. So proceeds from our tickets that we sold today are going to support House of Honourable Mothers as well as the Discourse's independent journalism. So thank you so much for everyone who has contributed to that. If you are interested in supporting the Discourse or signing up for our newsletters, if you're not, I just have these QR codes here that I can pass around, and then we'll hang them up on that post there for folks who are not signed up for our stuff. So yeah. So I think with that, and we're kind of like a packed schedule today, so feel free to take breaks as you need them, get up and leave, we won't take offense, so yeah. Okay, so to get started, I think I'm going to pass it along to our panelists here to just take a few minutes to introduce yourself, talk a little bit about your work, and then we'll go into a discussion. Sure. Do you want to start here?
All right then. So as you heard, my name is Bev Suderman. I'm the executive director, but I want you to be clear that that's a volunteer position of the Cowichan Women's Health Collective. We established ourselves in 2019, so we've been going for about 5 years. And our mission is to establish a community health center, a woman-focused community health center in the Cowichan region. So community health centers, and we don't have one here in the region. So I just thought I'd mention that that addresses both the medical needs and also the social determinant of health needs for, and our focus is specifically on self-identified women and their families. Over the last 5 years, we've done a fair amount of research around women's health issues, which go far beyond reproductive health issues themselves. And so we have a bunch of our research available on our website if you're interested in learning more. And I'll stop there because I could go on for a long time.
My name is Laura Interlandi, and I am the manager of Lelum, teyt-en, which I'm still practicing the pronunciation of all the time, and I know I could get better. The house was named by Indigenous elders, grandmothers, local to Cowichan, and is the culmination of a lot of efforts over many years of many community leaders and advocates to bring about. So I'm like here representing, but there are many people who made the house a reality and who contribute to its ongoing existence. Specifically, the mandate of the house is to prevent or reduce the number of child apprehensions locally by providing safety and support My personal professional background for at least for the last 10 years, I was a doula, a postpartum and a birth doula, and tended other reproductive thresholds as well. But I'm coming to this work with a relational lens and an advocacy lens. And I think that events like this are representative of the needs that people have, which is for collaboration between sectors and collaboration between practitioners and providers, and also our elected officials to be our voice and our representatives, where big decisions are being made and money is being allocated. And I think that collaboration is a really cornerstone to the work that we do at the House to make sure that people have circles of care as they are in their time at the House and beyond.
Yeah, I'm Emily. I'm a physician in Victoria, and I do mainly abortion care and reproductive care as my full-time job. So I've been doing that medical, surgical abortion care since 2021. And yeah, I'm just happy to be providing trauma-informed care to women, trans men, non-binary folks, two-spirit folks. That's kind of my main passion in medicine. I'm grateful to be here today as well.
Hi, everyone. My name is Debra Toporowski. My traditional name is Qwulti'stunaat. I am the MLA for the Cowichan Valley and the Parliamentary Secretary for Rural Health. Thank you for the Discord and Cowichan IWD for inviting me to this meaningful panel in recognition of International Women's Day 2025. It's an honor to join this important conversation on empowering and supporting more informed health decisions of women and gender diverse people. My gratitude goes out to the inspiring panelists for their expertise and to the audience for your commitment to creating positive change. I look forward to the valuable discussions ahead. Rural health in British Columbia has some significant challenges, particularly for women and Indigenous communities. Limited access for female physicians, women-centered care, and culturally sensitive services result in longer travel times to access the care people need. Poor reproductive healthcare options and high risks for women during prenatal and postnatal care. These gaps contribute to high chronic illnesses. This week, the finance minister introduced the budget in the legislature and included $443 million for improving primary care access and $870 million for, is it, you can't hear? Oh, yeah. Oh, okay. Is it too loud over there? Yeah. Okay. Okay. I'll try to talk louder. Okay. This week, the finance minister introduced the budget in the legislature. It included $443 million for improving primary care access and $870 million for the new hospital infrastructures over the next 3 years, identifying the Ministry of Health's 2025-2028 service plan. And the ministry aims to ensure the primary community care services are integrated, accessible, and well coordinated to meet the challenging needs of people in BC. A key focus is on equitable access, cultural safe for people in rural, remote, and Indigenous communities across the province. In 2024, the BC Ministry of Health released the BC British Columbia's population public health framework and strengthening public health. A renewed strategy outlined the province's long-term vision for public health. The framework highlights the importance of amplified rural perspectives and finding a new way to support the health and well-being of these communities. I'm dedicated to collaborating with key partners, including frontline service providers and rural and Indigenous communities, to gather their insights, expertise on how we can best deliver accessible and effective healthcare tailored to their unique needs. By working together to address the unique needs of the rural women's health, we can help create a new equitable healthcare system across the province, one that prioritizes the needs of all women, regardless of where they live. Thank you for inviting me to sit on the panel today, and I look forward to connecting with you all and hear about the valuable insights and discussing ways of advancing women's health together.
Thank you. Good afternoon, everyone. My name is Alistair MacGregor. I've served as the Member of Parliament for the riding of Cowichan-Malahat-Langford since 2015. I also want to let you know how much I appreciate being invited to be a part of this amazing panel. A lot of the work that I've done as your representative in Ottawa has been primarily focused in agriculture and food security, but more recently I've also done a lot of work on the Standing Committee on Justice and Human Rights and Public Safety and National Security. So through that work, particularly in justice and public safety, I have done a lot of work on updating Canada's firearms legislation. So looking at how intimate partner violence is affected with the presence of a firearm in the home, strengthening prohibition orders and the ability for firearms officers to revoke licenses. I have also done a lot of work on the Justice Committee, where we have looked at things like online harms, which affects a lot of young girls. We have looked at coercive and controlling behavior as well. But I've also done a lot of work in trying to establish a national strategy on brain injuries. One thing I learned in the course of that work was that for every NHL player who receives a concussion, there are over 5,000 women who receive a concussion from intimate partner violence. And who do you think makes most of the news? So there's a great disparity out there. And of course, with my work on food security, we know that it impacts women in particular ways right across this country, from coast to coast to coast. So I'll leave it at there. It's a huge honor to be joining you for this conversation, and I'm looking forward to beginning. So thank you.
Thank you so much. Thank you, everyone, for telling us a little bit about who you are and what you do. I was going to start off by asking you the question that we've kind of advertised as part of this event, which is what supports are needed to help women make empowered and informed decisions. But I think first what I want to ask, because I've heard such a varying response to like the kind of work you do when it comes to women's health, is what does women's health mean to you, and what do we need in our communities to make sure women can access what they need to be healthy and safe and secure? Whoever wants to start.
All right. I'll start. Women's health. So, health is a really interesting term because we talk about health care, but what we're really focusing on in most of those discussions, including the budget that Deb has been talking about right here, is we're talking about medical care and the challenge of addressing ill health or disease or one of those other kinds of things when things are not quite right. I think for the Cowichan Women's Health Collective, when we talk about health, we want women to be thriving, not just surviving. So that includes things like feeling a sense of belonging in community, feeling a sense of agency and control over one's own life and destiny, being healthy, having enough nutritious food to eat, having safe housing, which is an issue. So if we look at the overall picture of what creates health in our society, Dr. Shannon Waters will talk, when she was public health officer, would talk about the need for clean water and clean air, and that these are fundamentals. Without them, we don't have health. And yet we take them so much for granted that we're not even thinking about those. And then there's the social determinants of health. Do we have enough income? Do we have enough agency to be able to provide ourselves with safe housing, comfortable housing, nutritious food? Do we have access to be able to make medical appointments and meet our needs that way? So health itself is a pretty complex topic, and that goes for all genders. Within that, women's health, specifically women, self-identified women's health, the health of people who don't identify as binary, goes beyond that. Obviously, women are reproductively different than men, self-identified men. Within that, there's so much that we don't even know about women's health. There's been a lot of focus on reproductive health in various ways, which is great. We need that. There's been focus on certain types of cancers, but now we're learning also about how women's hormones also affect the ability to diagnose heart disease or strokes and prevent strokes. More women are living longer than ever before, and so it raises all kinds of questions about what are the healthcare needs of senior women at this time. As a woman who's approaching that myself, I'm starting to have all kinds of questions about those kinds of things. So I think, you know, the question of health is a little bit complex, which is one of the reasons why it's so challenging to address. And I'm in this business because my granddaughters are not getting as good healthcare as I did when I was a teenager. And so it's concerning. It's very concerning.
Would anyone like to add or expand?
I'm gonna read my message from the province, but you know, in our rural communities, women often face significant barriers to accessing health, including long distances, limited providers, and financial challenges. To empower women to make informed, healthy decisions, it's crucial to ensure that they have the access to the diverse range of affordability, equitability, and culturally safe healthcare services. And in my role as the parliamentary secretary, I've been meeting with other stakeholders and talking about rural health, and also, you know, it comes down to community, like our community health for women and what our needs are. And it's been amplified through COVID. Mental health has been one of the other challenges that has been heightened in these different things that have come out of COVID. You know, even personally, like things that like, you know, aging and things happening to us. Yeah, it's been it's a different journey, right? So having someone that knows your health as a woman or a female identified person of what's happening to your body is very important. Again, I'm really excited to work with the health minister in this role to be able to use all of the tools that I've gained through Health Advisory Committee, through Cowichan Tribes, and listening to folks that, like, looking at the gaps and identifying the gaps that are needing. So transportation authority program or whatever, assistance program or whatever it's called, TAP. And yeah, just looking and hearing from communities saying how it was a barrier for them to travel over to the mainland because they're waiting for that piece of paper. And also being able to use that email or piece of paper to show at the ferry to get on there faster and not wait for that piece of paper to come. So those are just some of the little things that can improve, but that was just one of the things that I wanted to mention.
Thank you.
Mm-hmm.
Maybe I'll piggyback on something that Bev laid out with the social determinants of health. Is, you know, federally, we don't have the jurisdiction over healthcare delivery, but I can touch on a few things, like food security for one thing. Like, we know that over the last couple of years that people are going through a cost of living crisis. And it has impacted both the quantity and quality of food that people have been able to purchase and provide for their families, particularly for women. And so when you're having that kind of a stress on the family, it can lead to really poor health outcomes. The other thing, so we absolutely must address that as one thing. Maybe on direct healthcare delivery, one thing I can speak of from the federal level is on dental care, because we have had tremendous success. Everyone knows that if you don't go and get regular checkups with your dentist, you can not have any particular diseases like coronary disease, maybe diabetes. If those are not diagnosed early enough, they can lead to huge health complications later on. Ever since we forced the federal government to start extending dental care particularly to low-income seniors, and many women were included in that cohort. I've heard directly from constituents right here in our local communities, from women who have now been able to access the dentist for the first time in years. And they couldn't go before because of the cost. And so by removing that barrier, because I think everyone in this room believes that accessing healthcare in Canada shouldn't be determined by how much money you have in your bank. We believe that's part of the social contract. So I think it's a part of this conversation about reducing those barriers, making sure that women have those empowered decisions. And I don't think they can make those empowered decisions unless we create the environment in which they can be made. So there's many pieces to this. Federally, we don't have that level of jurisdiction that they do in the province, but I'm proud to say that we have been able to force the federal government in some areas to show that leadership where necessary.
Thank you. If either of you want to add, or we can move on to another question.
I think a lot of what I believe has been spoken about. The other thing that I would add is, healthcare that is free of discrimination is really important. And recognizing the history of the weaponization of healthcare, particularly for Indigenous communities. Accessing healthcare can be a traumatic experience for people who themselves or their family members intergenerationally have been abused and harmed within those systems. And I think we need to be quite humble to that and recognize that people deserve support while going to doctor's appointments, particularly if they are likely or possibly going to be discriminated against on the basis of, race, sex, gender, and also class, like that happens as well. And in terms of reproductive healthcare, as a doula, like I have witnessed all kinds of things. And I was trained as a doula in New York City, and I operated a doula business in New York City for 5 years. And there's a lot of things that I'm obviously so glad to be away from now, being back home in Canada. But I also think we need to recognize that a lot of our systems aren't so different. There's still a lot of inequity, and with that inequity comes power and, power and control, coercive control, working closely with survivors of intimate partner violence, I'm very aware of, but I also see those same patterns of power and control and coercive control for people accessing supports and resources, and being at the behest of, say, a healthcare provider who becomes the gatekeeper to a referral resource, for example, or who may or may not be believing a woman and the symptoms and the experiences that she's having. And of course, we have so much inequity around research to begin with. So, we don't have data on so many things that we experience, especially things that are related to hormones. There's an inherent misogyny inside of medicine, and that also includes mental health as well. And so, true healthcare is healthcare that is free of discrimination. And I think people need supports to, in the room, literally in the room with them, at all kinds of appointments. And to understand that just because someone has a white coat on doesn't mean that they necessarily know the answer. They're giving you an answer, but you're also allowed to ask questions, and you're also allowed to, a tip I have for people is, if you're asking for a referral or some kind of intervention, say you want to get an ultrasound, you want to get something checked, and that's not being provided to you, you can say, I would like it noted in my record that I requested an ultrasound. And then guess what? You'll get the ultrasound, because no one wants it on the record that the thing was asked for, it wasn't followed up on, and then, hey, you do have cancer, right? So I think it's just really important to address that there are power dynamics in our society that impact people's willingness to even go to the dentist. The dentist is a big place of shame for a lot of people, and especially our most vulnerable communities.
Thank you. Yeah, completely agree with everything. I guess I would add to that, just to say that, yes, like there is systemic racism in medicine, especially. Oh, yes, sorry. So just mentioning that, yes, like there's systemic racism in medicine, especially obstetrics, gynecology, throughout history, and that's still going on. It's like it's still going on today. So being able to, advocate for yourself when you're going to doctor's appointments, have someone with you. Some people even bring like a recorder just to like, have all the information for later. One of the reasons that I went into doing the work that I do is because I saw like clear examples of how women weren't listened to with painful procedures, and pregnant people were given, disinformation. So I guess just to add that, like I agree with everything people are saying, especially about the social determinants of health. And having someone to advocate for you can just be a huge thing, especially like if you're wanting.
So for those of you who don't know, the Cedar Branches Shelter is a low barrier women's shelter here in the community. And so many of those women have brain injuries, whether they're from drug usage or from intimate partner violence or some other reason. They were doing, with the idea of having a shelter where they don't have to be kicked out first thing in the morning and then line up to get in again in the evening, have regular meals and so on. They were already doing so much better. But once healthcare was attached to that, by having a nurse practitioner come in one day a week into the shelter, women could get more ready access to trauma-informed healthcare. And then the system navigator position was able to assist them to follow through on the recommendations, whether it was getting their prescriptions and taking their drugs in a timely manner, going for tests later, and so on and so forth. The relationship between health and housing is so profound. And so if you can then add on the option of accessing medical care as well, for issues that you're dealing with in the moment, which many street involved people are dealing with a lot of health issues, that just makes everything better for everybody. And it was so profound within the shelter about how that access to that healthcare and the stability and the system navigator transformed the dynamics within the shelter. Yeah. It was a great project. Now we need to get it permanently funded. Small detail.
That relationship between housing and health is something that I hear a lot in my reporting in general. And a lot of what you've touched on are things that I've heard when I've spoken with community members as part of my job. When Gail and I were talking about putting this event together, we were trying to figure out what question we wanted to ask. And we were talking about abortion and childbirth and kind of like how people are even supposed to make a big decision about their health when they don't know what supports are available to them in the community. Or when there might be supports available, but they don't know how to access them. Or maybe there aren't supports available like in rural communities. So that's how we came up with the question of like, how do we build this circle of care? And it sounds to me like wraparound care is needed. So I would love to hear from each of you on what you think a solution would be, maybe in this community, maybe on the island, on how we can start to build that circle of care for women.
My work is always interdisciplinary, like there's always we're always necessitating collaboration with people are either pregnant or in usually the early postpartum time when they come to the house. And so they have it's a profound time. Birth is a profound time for people to become connected to resources. So there are these certain thresholds where people all of a sudden now they're in the healthcare setting. And so I think the hospital is a really important collaborator. There is the Rural Obstetrics and Maternity Project, Rome. Donna Wakowicz leads that or has been leading that. And I've been to several meetings at the hospital over the last couple of years with different people from public health, Margaret Moss Center, and social workers and how do we better serve specifically that project is about substance using perinatal populations, which there is a lot of substance using pregnant people in the Cowichan Valley at any given time and across the island. And the question was, you know, how do people will come to the hospital to access something. How do we then, what can they leave with that could be, if they choose to engage with services again, something they can take with them, or like how do we plant seeds of support, right? So somebody may come, they may access a short service or stay one night, and then they might leave again. And then they might come back. And if they receive great care and non-judgmental trauma-informed care, they're more likely to come back. And so who are the people that are likely to interact with vulnerable populations in particular who would benefit from additional circles of support or a wider circle of support? And then how do we get out of our silos, you know, our practice silos, and make sure that we know what, you know, I know what you guys offer. I understand where does my scope end and Cedar Branches begin, right? How do I get one of my clients who decides, you know, I don't want to be pregnant anymore, or is experiencing miscarriage? How do I get them great care? And how do we make sure that there are fewer and fewer gaps? Because the more gaps, this is where the harm happens, right? It's either, you know, people don't get seen enough, we don't have early intervention, or people feel like it's gone too far, right? They feel like they don't have anyone to ask. There's so much shame for people who haven't received good care in the past. And so, you know, the hospital, I feel like we need our hospitals to be community health centers. They need to feel like centers of healing, you know, in like socially and emotionally, as well as in terms of the provision of medical care, so that they're friendly places for people to come to and to ask questions. And a community health center, I think, is so needed in the Valley. I do know the Margaret Moss Center does a lot of great work. The Qwulti'stunaat Health Center does a lot of great work in that regard. And we need time, we need the budget and the time as people doing the work to be able to build relationships and maintain relationships. Because quite frankly, you know, you don't always feel like there's time in your calendar to sit down and to take a meeting and to really go deep with somebody about the work they do. But when you do spend that time, inevitably, there's a benefit that ends up happening for the clients you serve. But, you know, time is for most, you know, getting a meeting with a doctor is like, whoa, their time and your time. So that's something I think that's needed to build circles of care, whether those are conference style, panel style. Like, I think there's lots of ways to do it, but we need time with each other.
Anyone else?
I have a lot to say on this subject. I want to give other people a chance. Yeah. Go ahead.
Yeah, so in the experience that I've had in my parliamentary work, because it's come up in other areas for me, you know, a person's agency is very much dictated by the life circumstances they find themselves in. So when we're talking about how we build this circle of care, so many women, I mean, so many members of our community are just struggling with the day-to-day basics of staying alive. Like that is how difficult it is for people. And I want to correlate this to another difficult conversation that we had in the House of Commons. Part of my other work was on the Special Joint Committee on Medical Assistance in Dying. So it was a committee specially created. It's called a joint committee because we also sat with senators. And we were tasked by Parliament to look at all of the very difficult questions and issues surrounding medical assistance in dying. Two of the very difficult ones were with regards to persons with disability and also mental illness. And, you know, the question kept on coming up that, you know, we know that supports for persons with disabilities and also mental health supports for individuals, They are not where we think they should be. And so for people who lack those available supports, they are getting less and less agency because the number of decisions that they have open to them are getting narrower and narrower because of their life circumstances. Someone who is wealthy, well-housed, comfortable, has a lot more freedom to make informed and empowered decisions than someone who is living on the street, suffering with mental illness, with little to no support networks. And so when it comes into the context of a difficult subject like medical assistance in dying, the cautions and the red flags that were repeatedly being thrown up in front of our committee were that does someone who finds themselves at the very end of the rope with little to no supports, suffering from a mental illness, a debilitating disability, are they actually being forced into choosing medical assistance in dying early because they did not have the agency and they did not have the supports to allow them to make that informed decision? So let's take it to the context of what we're discussing today, building that circle of care. So I think we need to find ways where we are lifting people up, that they have that economic empowerment where their day-to-day lives are not just scraping by, but they feel like they've got access to shelter, they've got access to proper food each and every day, the basic necessities of life. Because we can talk about building a circle of care, which includes all of these kinds of supports, but if people are just barely struggling to get by, women are just barely struggling to get by, they may not be even aware that those supports exist because, again, their day-to-day existence is just so consumed with finding those basic necessities of life. So I think that's something we really need to tackle.
Before I read my notes, I just wanted to say, just adding to that as well, I was really excited scared and excited at the same time that I was put it under the health minister as the parliamentary secretary for rural health. And when the mandate came out for the health minister and what she was, said to go out to do, directed, it was sort of like the umbrella of everything. Mental health and addiction was brought back under health. And that's great because that's what people in BC were saying that was needed because it was a disconnect with the health. And again, I think part of that was probably because of COVID and all of the things that happened, heightening everything 10 times in our community. But also we live in a really wonderful community here in Cowichan because in times of a crisis, the organizations that were meeting beforehand got together to say, hey, we can do this and we can provide those pods, the village was created, where there was wraparound service for people that were on the street. And again, like Alistair had mentioned, women also coming out of abusive relationships. I was one of those women and I didn't know. If I wasn't in the hospital getting an operation, I wouldn't have found the social worker come in and talk to me and say, there are these services for you. And you can get the help that you need. So I think that's where, connecting all of our experiences as women, I'm getting older, and then using those experiences to help everybody in our community. And I've been really happy to be put in this role as the MLA for the Cowichan Valley because I've worn so many hats and now I can wear, well, actually 2 now, but it's under one government. So being able to have that power to help the community and connect people to the resources that we need and identifying those gaps. Do I answer that question now that you were asking about the requirements? Because I have this all written down.
You're welcome to. Yeah.
Okay. All right. As mentioned earlier, in rural communities, people often face significant barriers accessing healthcare, including long distance limited providers, and financial challenges. To empower community members to make informed health decisions, it's crucial to ensure that they have access to a diverse range of affordability, equitability, and culturally safe healthcare services. And like someone mentioned here earlier, the Indigenous community has really had struggled with healthcare. We had those hospitals out in Nanaimo, Port Alberni, where the elders talked about being experimented on and all those horrible things. So going to a hospital or a doctor is a very scary experience. And also there's the trauma from being a residential school too also affects all of those things of accessing the healthcare in a way that you need it when you need it. The Ministry of Health have a number of key initiatives to help women address these barriers and help make empowered and informed decisions. For example, in 2023, the ministry made prescription contraception free for all in BC residents and expanding the pharmacist scope of practice to reduce cost barriers to improve access across the province. Additionally, the BC Pharmacare covered 100% of the cost of medicals of abortions, enhancing access to reproductive services and empowering individuals to make informed decisions about their reproductive health. The Ministry of Health's Transportation Assistant Program that I talked about earlier, TAP, also offered eligible BC residents to waive or discount fees for transportation costs when traveling within the province for non-emergency medical specialist services, which included pregnancy option services not available in their community. Telehealth service has significantly expanded its recent years and improved access to healthcare for many individuals, particularly those in remote and underserved areas. And I heard from a lot of people that wanted to enhance the telehealth because it's been helping in their community. So the minister's looking into that right now. The HealthLink BC website provides comprehensive information on pregnancy options, including available services across the province and the contact details for the pregnancy options line. And together, these initiatives help women stay informed and empowered to address their health challenges on Vancouver Island. So, yeah, thanks. That was a long-winded thing, but
That's great.
yeah.
Sure.
Sure. Yeah.
Go ahead. So when I was thinking of answering this question, I just thought first in a broad sense of what we can do to support women and pregnant people. And firstly, I think about that in a legal sense. So ensuring that abortion and reproductive care remains legal and safe, which it has been in Canada since 1988. However, there have been numerous conservative MPs that have brought forth legislation to try to limit access to care. And the way I think about it is that any bills that are going to limit care are all considered bad. We don't want to have any bills that are even trying to legalize abortion, because in like the medical sense, abortion should just be a medical procedure. So we don't want to have any laws that will say, yes, it's allowed, because we don't have any laws for other medical procedures to say, yes, an appendectomy is allowed. It's always just a decision based on the patient, their doctor, and whoever else that they're bringing into their circle of care to help make a decision. So just to, yeah, when you see these bills being brought forth, to bring attention to it and help, yeah, not let them pass. That would be my first thought. And then secondly, just keeping organizations funded that are truly helping Canadians. There was the largest abortion charity in Canada is called Abortion Care Canada. And this year they did not receive funding from the federal government, which potentially could shut them down. So these organizations, they need funding to be able to provide people with the resources for travel grants. They have phone lines that people can call in to say, like, where is my closest abortion center or miscarriage center? So having funding for these organizations is really important. The other types of like more broad organizations would include the All Options Line and Action Canada. And these places have a 7-day-a-week phone line that patients can just call in, receive very good information from actual professionals, unlike some of the information they might find from crisis pregnancy centers. And if you're not aware, there's actually more crisis pregnancy centers on Vancouver Island than abortion centers or hospitals that provide abortion. So those places usually have, like when you first look at them, they can provide what you think are good services, but underlying them, they have a lot of anti-choice rhetoric, and they give misinformation to patients. So I've unfortunately had many people come to me that have visited a crisis pregnancy center first. Then they see me and they say, I was told it would ruin my fertility, that I would get depression from having an abortion, all of these things that ultimately are just making them feel shame. So getting the information out there that these places are doing this to people. And there has been some like government response to try to take away some of the charity status funding of these places, although it hasn't went anywhere yet, from the federal standpoint. So yeah, I wanted to bring that up. And then lastly, I just wanted to also plug an organization in my community. It's a service called Abortion Support Collective. And this is a group of doulas that work mainly with patients for abortion care, which includes miscarriage care for multiple reasons, maybe ectopic pregnancy, molar pregnancy, or terminating for medical reasons for the life of the parent or a severe fetal anomaly. So this organization is community-based. They have also come up island, so it's a resource that people can be aware of in Cowichan as well. If you need to have a ride home from the hospital, say if you're getting a surgical procedure, or if you want to have someone to advocate for you during an appointment, you can have some of these doulas come with you and they can be a great resource. So that's kind of one of the supports that I found in my community that hopefully could be helpful. That's it.
You have lots to say.
I do. And some of it's been said already. So maybe I'll just suggest that, you know, from our perspective, there are 4 main areas to build a circle of care. The first one is to make sure that there's access. So it can be as fundamental as, is there a doctor in that community? Like Cowichan, for instance, is looking at 0 doctors by June, I think.
Yes.
But it can also be things like stigma or classism that creates barriers to access for many people. So when I say stigma, I talk about, I'm thinking about people who are street involved, who want to go to a doctor, but when they walk into the doctor's office, there's this sense that they're somehow different or other. And so they're othered right from walking through the door, which can be problematic. But classism is also, it's not a term we talk about much these days, but it does make a difference. I think we kind of referred to it, well, Alistair did, when he talked about how wealthy people have more choices and poorer people have fewer choices. And I think that there are many dimensions to that, but it's partly in our publicly funded system. It's about your ability to pay in order to be able to do that. So the second key support that is needed is information. People need to get a full background of information on whatever their particular issue is so that they can make informed choices. And sometimes that information is what's known about a situation, but sometimes it's also what is unknown about a situation, because you can't know what you don't know, right? And so within the field of medical research, there's been a lot of gaps in terms of when things involve women and when things do not involve women in determining whether drugs are safe, for example, or how much anesthetic to give for surgery, or how hormones affect different conditions. So it's really important, I think, for whatever organization or professional that's providing information to share both what is known and also the limitations to that knowledge and what is not known. The third thing then, so once you have access and once you have that information, then it's about choice. Knowing what your choices are within that, having options available to you, and being able to work through what those options are, what they mean, what are the pluses, the minuses, in a non-judgmental way. And I think that, you know, in our research, in the Honoring Women's Voices research, the need to have non-judgmental professional opinions came up multiple times. And then the last part in terms of supports, so you have the choices and so on, but you also have to feel safe in making those choices. You have to feel safe in the doctor's office, or you have to feel safe in the community service office. And safety means that those organizations and those people should be trauma informed for sure, at a minimum. I will say, I'll go out on a limb and say that I do not know any women that have not been traumatized in some way or another, and that affects the interactions that we have with others in our community. Cultural safety, though, and you know, going back to the residential school experience, the weaponization of healthcare for Indigenous people, cultural safety is a very, very important component of this. And when we think about cultural safety, we often think of it exclusively with regard to Indigenous people, but it's not just Indigenous people, it's also immigrant people and refugee people and various people. Queer people. Yeah, seniors and queer people. We have many different cultures in our communities, and so it needs to be safe for everybody. So those are, you know, I think to sum up, if you're going to build a circle of support, it needs to have those four components at a minimum. One of the projects that we did last year was gap analysis for youth services in our region. You may or may not know that we're having a youth mental health crisis in our region. The Public Health Association of Canada thinks that it's problematic if 5 to 6% of adults in our country are having mental health issues. The most recent study in the Cowichan region of youth indicates that the number is somewhere up around 46% of youth here in our region are experiencing anxiety, and that manifests in multiple different ways. So one of the solutions that is out there that we have not yet accessed in our community is the idea of a foundry or a foundry-like approach, where it can be a one-stop shop, where there can be a lot of advertising about the one-stop, so that there can be, and then when that youth or the family member walks through the door, they have one intake. They don't have to say multiple times what their story is in order to be able to access services. It's integrated with medical health services, mental health services, counseling, cultural supports, and various other things. In order to, and each foundry can be customized to the community that it belongs in. And so this is one of the calls, and we're hoping that over time, this will be something that we can have in our community. And I think it's good for youth, but it's also good for all people in our community to have that kind of ability to walk into a place, tell your story once, and then get connected to all the people that you need to help you. So that would be part of building a circle of support.
Thank you. I'm just looking at the time. We have about 20 minutes left to this discussion. I want to leave a little bit of time for questions if there are any, but my last quick question for all of you, if you had a wish list of things that could happen like tomorrow in our community to support women, what would it look like?
A women and family centered community health center.
More funding for research into all the different types of conditions that affect.
And from my understanding, like that kind of research is still quite new, right? So we're still learning so much about
So much,
women's health.
yeah,
Yeah.
is coming out that should have been studied a while ago, and, you know, certain studies excluded women and people with the uterus, and yeah, so we're just learning a lot more, and we're hopefully getting better at it.
I'm really excited for the opportunity to tour the Sea Wave second stage housing that's popped up, because that was on my wish list big time. But I do think just, you know, family-centered, supportive, you know, subsidized housing, like, and subsidized, like, $2,000 feels subsidized, like, you know, it's crazy, like, but really actually subsidized. You could live on PWD, you could live on, you know, a very low income and actually live, is such a part of the continuum. I also think right now, this may seem like low hanging fruit, given the scope of our discussion today and all the needs, but like, it's really problematic that there's no buses running right now.
Yes.
How is somebody going to get to the hospital? How is somebody going to get to the doctor? Like, why is this an issue? And I had somebody move out of the house of Honourable Mothers recently and like done all their things and like mitigated all their concerns with the ministry and been in recovery and like all the things. And now sending them out into this world where there's nary a bus in sight, you know, like just felt really ridiculous. Like they've done their work. They're, you know, and now they can't even get their toddler on a bus to take them to the doctor. Like that's failing people today, right now. And so if we can't have like and transportation, I'm sorry, it's not adequate even when the buses are running.
No.
We need, you know, rail up and down the island. We need buses operating overnight. That's a safety issue for women. You know, like if you can't get on a bus at 11 o'clock at night, then you're in a pickle. And we need, we need a lot more, just basic resources in the valley, as well as all the other things.
Question for the panel. Just say one thing on that. We definitely need better public transit and at minimum buses that run once an hour, because who can plan a schedule on 90 minutes? The fuck?
Yeah, right.
Seriously. But on top of that, even if you had great public transit, I think it would be very difficult to plan for a community in which most of the roads are cut by glaciers. And so a solution, I think, for rural health, particularly in the valley with our geographic challenges, is doctors on wheels. Right? Put wheels on the doctors and have them go out into the community on a route. On Tuesdays, the doctor does this area, and on Wednesdays, the doctor does that area. Because otherwise, you're going to end up with an insurmountable challenge. But on top of that, I think our transit system should also include sort of like something that's kind of like an Uber, but gets you to the hub. Right, like small mini buses or even just SUVs that get you to the hub. And they run on demand. Yeah, sorry, but I really have to talk about the transit. I came from the mecca of public, one of the two meccas of public transit in Canada. And not anymore, thanks Doug, but it was really, like, you could just walk out and know that there was gonna be a streetcar.
And right now you can't get even a taxi after 7 o'clock at night.
Yes,
So for women,
that's true.
yeah, that's a scary situation.
Shall we continue with the wish list?
I know Deb's taking notes.
Oh, I am, for sure. Yeah, well, I was just thinking about, one other person that I had met with a couple of weeks ago, talking about 0 to twilight and having that thing from, you know, when you're born to seniors and having that healthy community options that we need for our community and making sure that we don't leave anybody behind in our healthcare. And that's where I'm at. And also, as what Bev said about the health center, I want Cowichan tribes to get their health center this time. And so that's, you know, they've been working on it for 20 years, I think, so.
Are you talking about the birthing center?
No, the
Oh,
Saylton Health, you know, the Saylton Health is outgrown, it's.
Oh, I
it's
see.
So
Oh.
having a health center that
oh,
would have seniors and youth in the same building, and then, and the middle would be for the health. So there'd be nurses and doctors or whatever that they need. But the elders program would be connected to the youth. And I saw, you know, in Victoria, in the Jewish community, a group of people just got together, built their own church. Have they're opening a seniors house next door, because they're in the middle of purchasing that. But within this center, they have daycare. And they bought the house next door, and it's full of kids. It was wonderful. Next, you know, and then walk through the courtyard of this fabulous thing that they had. And then, you know, it's just a playground. I wanted to play there, but we were in a rush. It looked so much fun. And just having another school going on for the younger ones, and another portable. So person had a dream and they just kept building on it. So I was thinking we need one of those in every community, but yeah, so.
Yeah, I think I would just, you know, there's so many things you could put on this list, but if I had to narrow it down to just one, I think I would echo the wish for safe and supportive housing and meeting people where they're at. You know, it's quite obvious that the free market is not going to fix the housing problem on its own. And I very much understand the needs for adequate transportation, access to services. So we have to find a way where we build that kind of supportive housing that allows for those services to be close by. I just think that, you know, when you're sort of compiling a hierarchy of needs, it just feels for someone who doesn't have a safe place to lay their head at night with a warm roof over their head that's going to keep them protected from the elements. Unless you solve that, worrying about the other stuff, I think that's a crucial first primary step, is giving a safe place to have to their own, and building services around that. So if we're narrowing it down to one wish list, I think that would be a key one. Yeah.
Thank you. I'd like to open it up to the room if anyone has questions. And also, Eric, if there are any that come up in the chat online, if you can just shout, that'd be great. Go ahead.
There's a comment on the thing, but when COVID hit, you alluded to, you know, the collective here through our community health network and CAPS and all the rest of them created, you know, the little pods for people in the house. And it has to be remembered all the time that everybody was housed. Everybody was housed for a very short period of time during COVID because the federal government paid the funds. And then they said, COVID's over. Yeah. Funding stopped. So it just has to be said that, you know, we can do it. We can house the unhoused. So then when we house now we have a village, which is remarkably amazing. And it has basically what we're talking about, doctors on wheels. All the supports go right in. And they let every people go part today, really, really well. So we haven't had actually. So it just is, that would be my wish. If I wish we'd get more villages, or we'd have just more money from the government to carry on creating small villages, because we can house our unhoused. We can have a place for people to lay their head and go to the bathroom. We're not going to get them around. We're not going to clean up our sites. We're not going to keep them healthy. It's just a big mess. It's just great what you're saying. Appreciate you saying that. We need more housing.
Yeah, and if I could just add to that really quickly, you know, if we don't, because I always try to figure out how we speak to the other side of the political spectrum in language that they will understand. If we don't address these problems, the cost to our society is immense. It costs in Canada about $150,000 a year to house one male inmate in a federal correctional system. The cost is over $200,000 for a female inmate. And we know that in our federal correctional system, amongst women, it's disproportionately Indigenous women, women of color. So again, the cost to our society immense, just on economic terms. The rise in crime, the things that businesses go through. This is actually the smarter investment. And I always hate it when people say that like we can't find the money. You know, in the time since COVID, you know, if you compare in major corporate sectors, you compare their earnings in 2019 to like 2022 and 2023. Look at all the big corporate sectors. Oil and gas saw an over 1,000% increase in its net profits. The same goes for real estate, for banking, for telecom. The gap between rich and poor has widened into a chasm right now. And I'm going to sound a little bit revolutionary here, but like we need systemic change. We need to stop the 40 years of corporate debt because those have carried on to, and the chickens are now coming home to roost. So we really need to address the huge economic, systematic inequality that we've seen. Otherwise, the costs are just going to keep on multiplying, not just economic, but also social. It's affecting how our communities operate. And if you let that fester for too long, people start losing faith in the institutions that are supposed to be there to protect us.
I have a dream, and it also is potentially a way to pay for all of this. So I have a cannabis farm up in the Glenora area, and the cannabis industry has provided like over $400 million to the BC's economy in just excise taxes alone. Excise tax is way too high for what we're doing, and we do need tax reform in order to be able to combat the illicit market, which has been proven now with studies that 97% of them are filled with harmful pesticides like myclobutol, which is cancer causing. So the cannabis industry does need help. However, we can help you back because with all of this money that's been collected, it's gone to the province's general ledgers, but I have a dream that we would be able to allocate some of that tax money back to our communities in a pilot project where it's direct source funds of what, like, because my company is paying over, you know, $15,000 a month in excise tax. And so wouldn't it be great if I could give, you know, even 10% of that or 5% of that or 100% of that to my local community, because wouldn't $15,000 in supportive housing or women's health or food security, any of those things, wouldn't that be a great use of those funds instead of just going into the province's general ledger and being used on who knows what? So that is something that I would love to be able to get some direct funding in a pilot project to be able to support our communities, because the municipalities have voted for 5 years to try and get some of that funds, and they've been told by the Minister of Finance that no, tough luck. So that's something that is my dream, to be able to help fund this.
Oh, yes, go ahead.
Two things. We need foundry. I just want to reiterate that. Somebody else brought this up. We need a foundry. We need a single door, you know, the youth can go into and tell the story at once. Because we know we have a crisis when it comes to youth. The second thing I'm going to jump on is that transportation thing. We really do need to get our heads together on transportation. We can't rely on the couch, you know, CBRD, although we need to be, you know, on their doorstep, lobbying for better bus service and all that sort of stuff. But we need, you know, it looks like community is going to have to come in again, right? And come up with, you know, which means we need funding, which means we need to be putting together a collective that talks about transportation. And I'm going to invite you to that collective. Anybody who's very interested in that, please come and see me. because we're starting one right now for transportation of the couch. So I'll just leave it at that. I know for older people, transportation is a big issue. People can't drive, they've lost their license. They don't have the license, they don't have, whatever. They've lost their partner and did all of the driving, et cetera, et cetera.
Even if you have a car and you
Vision.
need to go see the doctor, you
Yeah.
don't have money for gas.
Yeah, exactly. So
Right?
there's
Like
so much. Yeah.
it's $5 to go anywhere from your house that you're gonna drive. Sorry, didn't mean to interrupt, but.
I saw a hand here.
Sore spot.
My name is Jody. I have been working on a women's health hub collective concept for quite a few years now with my matriarchs. And I've just gone out on a limb to put a deposit down on a rural property that's off of Winchester Road, right beside Johnny Dare. And my thinking is, there's a lot of healthcare givers that are suffering from burnout. And who cares for the caregivers? And so my narrative is I'd like to be able to go into the rural community and offer the new medical device that my company is brought to. That is to improve systemic blood circulation by up to 30% within 8-minute sessions. And so to be able to provide a new medical device that's easily accessible to everybody, to provide a rural environment, to be able to have people going through and improving their blood circulation in record time is something that I'm very, very interested in, because better blood circulation means better health, no matter how you look at it, whether it's in a last surgery type of environment before or after. So if we can provide that in a rural environment, it's a very quick in and out. You come in for 8-minute sessions and you're on your way. I'd also like to be able to provide a day type of program. So if you're coming in for your blood circulation sessions, that there's also a saltwater hot tub that can be used. There's also a sauna. And we talk about sweats amongst the different nations. There's no smoke involved in this type of sweats, which is also very, very good for the lungs. And we can provide all sorts of other different health modalities that are easy, non-invasive, and that can get the community up and running in a health situation, a much better health situation that much faster. So I'm going out on a limb here because I feel that the medical device that we've brought to Canada we've only been here for 7 years. We've come from Liechtenstein, Germany. We're a 26-year-old company. And we have a proven history and lots of papers written up with regards to our national health doctors. We're in 40 different countries all throughout the world. And we're the last to be in Canada. So we're the 42nd country to have it. So in a rural type of environment, I'd like to be able to work in clinic and be able to provide complementary healthcare to our healthcare givers. And that's the biggest thing, because in order to be able to have healthy communities, you need to have healthy bodies. And this will work its way into us being able to develop ways to create accommodations. Once our bodies are feeling healthier, then we can reach out to other communities and help on many other different levels with regards to education. How does the woman take care of her body as it's getting older? I'm a middle-aged woman as well too. Sorry, sir, this is not going to concern you, but the thing is, our bodies go through all sorts of wonky changes. And so to be amongst a group of women that are the same, let's say, our vintage, let's just say that we can go ahead and we can start doing these sorts of things in the community. And there are many other doctors that are open to having, like we were talking about having a circuits as well too. So you're talking about having teams come together. And we can have many different types of practitioners. It could be a chiropractor, could be a Reiki practitioner, it could be hyperbaric oxygen, could be a beamer clinic. And so once we get all of our team together, we can have a circuit set up, and we'll have a shuttle service as well too that we'll have to implement. And shuttling everybody, of course, is really important, as you just been speaking about. So again, I'm excited to talk to you about health and how we get our healthcare back on track, non-invasively, in a very short order. So with that, and I look forward to speaking to all of you. So that the place is set up, we have the location, now it's just a matter of us funding it. And whoever's interested in that, I can talk to you about that afterwards. So thank you.
I just want to note it's 4 o'clock and I know some of our panelists might need to go, but I know there's one more question here. If it's okay to hang out for a few more minutes? Yeah.
It's not a question.
Okay.
For quite a bit of my life, I lived in the east. And there was always cheap transportation, you know, the tuk-tuk. With motorbike and, you know, and even people with bicycles in the east. And they're all kind of, it could be accommodated or people could provide. And it was so good for seniors because it was just local. You know, take you into town, take you back, and it cost almost nothing. I don't understand, you know, got electric bikes, you can build little houses on it. Some innovative person could do something, could change it for the less. It's my.
Yeah, I know you can't hear it, Pat.
I have to go and pick up one of my kiddos. But I just want to say thank you for having me, having us. And I also wanted to leave with a really positive just anecdote because all of this is connected. And I think that's one of the themes is that transportation, housing, food affordability, choice, you know, access to healthcare, trauma-informed, all of these things are connected. And I think that we do have to speak outside of not only our practice silos, but our like political affiliations. Like that's a big danger if we're learning anything from our neighbors is that there's some really great organization happening on the right. And we really need to be mindful about how we're not splintering in our own communities and we're collectively organizing and also being able to have hard conversations with people that think differently than us in real life, not just online. And there is economic benefit to the investment of all of these things we've talked about in terms of reducing the number of adverse childhood experiences. You know, we see that later in life in terms of how much that costs our system. Being able to have any kind of preventative care is going to impact economically in a positive way, all of us. And I thank you for bringing up that like myth of scarcity because there's no scarcity privately. And so we need to be a little bit braver in pointing that out. And I think one of the things that can be really hard is people will say, well, that doesn't affect me, or, you know, oh, well, these people are a lost cause, or I don't know why we'd put more money into that. We're still seeing this outcome or this outcome or that outcome. And, you know, we have to provide choice that is unconditional. We have to provide care that is unconditional. So people don't owe us healing and they don't owe us positive outcomes. Human rights is to receive care. And yet there are some really amazing outcomes that do happen when the supports are good. And I get to see a lot of things, a lot of hard things, but I also get to see a lot of amazing things in the work that I do. And I have clients who have graduated. We don't use that term, but they've moved on from our program in a positive way with their children having never been separated from them, even having other children returned to their care and moved on. And some of those people were people that accessed OPS, the people that accessed harm reduction services, people who lived in the pods in the village, and who you would not recognize them from then to now. And so, you know, none of this is a waste. None of this is for nothing. Whether people have that, you know, positive story, shiny story, or they don't. But I get to see some of those positive, shiny stories, and they do exist. So yeah. Thanks. I gotta drive.
Thank you so much, everyone, for being here and for contributing. I hope
Mr. Chairman.
everyone took something away from today. And thank you so much for being here and joining us too, as well as the folks online. Yeah, any final words, or can we wrap it up?
Thank you for organizing the event. Thanks for inviting.
Thank you, Dan.